Good afternoon. Please be seated. On behalf of the College of Nursing and Health Sciences, it is my privilege to welcome our graduates, their families, friends, and our distinguished guests to the 2021 School of Nursing pinning ceremony. We do have, in addition to President Weaver, who will be sending you greetings shortly, Dr. Suzanne Smith, our provost, is here this afternoon. Would you please stand, Dr. Smith? Please join me in welcoming her. Thank you. This ceremony is symbolic in that our nursing faculty welcome our graduates as they cross over from the role of student to that of professional nurse. It is one of our few long-standing traditions in nursing education that remain. In fact, from 1956, when Georgia Southwestern held its inaugural pinning ceremony, we have held a pinning ceremony each year, with one exception, last year. And as a result of the COVID shutdown, we were unable to do our pinning or other special occasion events, but it is with much joy that we resume this tradition, and we certainly plan to continue it as we move forward, because this is an honor of our past, but a celebration of our future as well. Graduates, I don't have to tell you the experiences that I know, and I know just a few of them, that you have encountered like none other. We could not have imagined how drastically our world would be rocked last year. And you were in your second semester of studies, as I recall, so it had to be rather traumatic. And yet, with those challenges, there were many opportunities, and we have seen doors open, and we have really witnessed so much innovation that has occurred as a result of that. You learned firsthand how nurses as a profession, we always talk about service, and all of our nursing students participate in various community events, but there was a national mobilization of nurses over the last few months, and every one of you, to my knowledge, participated in vaccination clinics since about December of this year. This is an example of how we serve, and it is an example of your calling as a nurse. I could not be prouder of a group of students. And that was all occurring while you were adjusting to new ways of learning and new ways of practicing nursing and healthcare. But you served our public and you served our communities, and we are better for this. In fact, look at me today and look at most of us, we are not having to wear masks. That is wonderful. I did see too that I think your success, our success at the university and as a profession is because you learned very quickly to put the we before the I, and that is what you've done over the past year, and that will make a huge difference as you move into your profession. I would like to take a moment and ask a special group here to please stand, and that would be our nursing faculty. They have taught and mentored you for the last 2 years. Maybe some a little longer, some a little less, but I am blessed to have that faculty, and they have had an unwavering commitment to your success. They have mentored you, they have assisted you throughout this, and you have received an excellent education as a result. Please join me in applauding our faculty. I do have 2 bits of advice for you. Please, as you enter the nursing profession, There are some who have gone before you, and they have acquired not just clinical skills, but that intuition and wisdom that comes with moving from novice to expert. Please take time to listen to those who are practicing and learn from them. They have much to teach you. And honestly, it's a lifelong occurrence that will be needed. And you will be teaching as you transfer your knowledge to new graduates very shortly. Secondly, I'm not going to lecture you today, but there is one more exam ahead, and that is your licensure exam. So I do ask you, because the public desperately needs you on the front lines very quickly, study just a few short weeks and study hard and pass that licensure exam the first time so you can join our professionals and make a difference in healthcare. So I want to be the first one to welcome you into the most trusted professions in the world. Congratulations to each of you. I am proud of you. You have stood the test despite all of the inherent risk that came with it. And now it is my pleasure to welcome our president of Georgia Southwestern State University, Dr. Neal Weaver. Thank you.
Well, good afternoon. Dr. Daniel thanked and acknowledged a group of people that I want to make sure they know how much you and me and all of us appreciate. The faculty of this department had to adapt quickly. They had to be creative. They had to be problem solvers. They had to find a new way when everything that we knew was not the same. And so I want to express my appreciation and the appreciation of the university and all of the students to the faculty of our nursing program who didn't miss a beat and didn't delay the life and the career and the progression of the students. So thank you all very, very much. You have a lot to be proud of on a regular basis, but you have a lot to be proud of with this class. As students, the nursing students, generally speaking, are a real pride of this institution. We know how good you are. And over the last 3 semesters, you have proven it. You have proven your toughness, your resilience, your willingness, your dedication. You have made this institution very proud. With your academic work, it hasn't been easy. This program's never easy. It's even more difficult when we change the rules halfway through it. But you also made us proud because you didn't shy away from the challenge that was presented to you. You stepped up and you said, I'm going to serve my community. I'm going to serve the people that I'm preparing to be a part of and my profession. And you did that with the university. You did that on behalf of the university. And you couldn't have made us more proud. And so we thank you for that. And we won't forget it. And I hope that you won't forget it. It was unique. I've been alive over 50 years. I've never seen anything like it. You guys are young. You think this might happen every 20 years. I don't think so. I hope not. But we do appreciate it. One of the things I want you to know is that when you graduate from Georgia Southwestern's College of Nursing, people have expectations for you because the people that have gone before you have set the bar pretty high. When I talk to administrators in hospitals throughout the state, when I talk to chief nursing officers, they tell me, we want your nurses because they're the best. They expect you to be the best. And I know that you've been prepared to be the best, but you have to meet that expectation. You have to be willing to meet the GSW standard, and I know you will, and we're excited for you. But I also want you to know that your experience here at the university has prepared you beyond just nursing. The things that you've been involved with outside of the classroom, the experiences that you've had, have also prepared you to be excellent decision makers, team leaders, excellent professionals, co-workers, family members, community members. You have a lot of skills beyond just the nursing skills, and I encourage you to use those and to access those as you develop your career and your life once you leave here. One of the things that we hear from hospitals in particular is that sometimes nurses start their career, and after a couple of years, there's a pretty high attrition rate. I know none of you will stop, but there is an attrition rate. And I want you to remember, if there's ever a day where you think, maybe this isn't working out, we need you. And there are lots of things that you can do. Don't be shy from talking to your colleagues, your supervisors, your hospital administrators, and making sure they understand this. Maybe what I'm doing isn't, but I still want to be a nurse. I still want to help. I still want to be involved. Don't stop out on this profession. You've put in too much work. You are valuable, you are needed, and they will help you stay engaged. So if that challenge comes, don't shy away from it. Don't be afraid to talk about it and find the right path for you, the right professional career path for you. We need you desperately. And I know some of you are leaving South Georgia, but if you ever need a place to go, you're always welcome back here. We hope you know this is your home. We're proud of you, and I hope that you wear that white coat with GSW with great pride. Congratulations on reaching this milestone. As Dr. Daniel said, I know you still have one more test to go, but we know you'll do well. I can't wait to see you tomorrow morning, right? You guys are in the morning? I'll see you in the morning right back here. And I'll make sure you get a diploma, okay? Congratulations.
Good afternoon. I'm Teresa Teasley, Associate Dean in the School of Nursing. Congratulations, class of spring 2021. You've worked long and hard to get where you are today. We are so proud of each one of you and are happy to celebrate your accomplishments. As an alumnus of Georgia Southwestern School of Nursing, let me be among the first to welcome you to the nursing profession. Let's give them a great round of applause. So it's my honor tonight to present awards to our students. The first award is the Cynthia Dudley Academic Nursing Award. This award was established by Dr. Gatewood Dudley in honor of his wife, Cynthia Dudley, a nursing graduate from GSW's nursing program. The award is presented to the graduating student from the College of Nursing and Health Sciences at Georgia's Southwestern State University who has achieved the highest grade point average while a nursing student. This award is given to one nursing student per year. When I asked her faculty about her, here is what they had to say. She is a leader amongst her peers, especially in simulation labs. She helped her classmates stay focused and is not afraid to ask the hard questions. She is not afraid to get help. She is always ready to learn. The recipient of the 2020-2021 Cynthia Dudley Academic Scholarship Award is Megan Van Horn. Megan was recognized at the University Awards ceremony a few weeks ago, but we would like to present her tonight with a plaque and a very generous scholarship award check. Megan has accepted a position with Crisp Regional and will be working in the intensive care unit. The next award is the Sigma Theta Tau Outstanding Leadership Award, and it's being presented from the Mupi chapter, which is our local chapter. I serve as vice president for the chapter. It is our International Honor Society for Nursing. And before I present the award, I'd like to tell you a little bit about it. As I said, it is the International Honor Society for Nursing. We induct students once a year into the Mupi, and there are criteria that they have to meet to be invited into the organization. We had our induction ceremony virtual in December, first time ever for us to have an induction virtually, but it went well, and we inducted 11 graduates as new members into our Honor Society. 6 of these graduates are from our BSN program track, and I'd like to recognize these students again for their academic excellence. To be invited into the International Honor Society for Nursing, undergraduate students must achieve academic excellence. That's a 3.0 or higher GPA based on all previous college coursework. They must rank in the upper 35th percentile of the graduating class and meet the expectation of academic integrity. So not only do they have to meet the international standards, they also have to have recommendation and vote by faculty. Students, please stand as I call your name and remain standing until I have called all of the names so that we may recognize you here tonight. Catherine Griffith, Olivia Payne, Erin Reagan, Amber Sims, Megan Van Horn, and Ashley Ansley. Please help me give them a round of applause. You guys may be seated. Remember to wear your purple honor cords proudly tomorrow at graduation to represent Sigma Theta Tau International.
It's my honor to also present the Sigma Theta Tau International Honor Society Mupi Chapter Award for Outstanding Leadership. This student was selected by faculty for demonstrating outstanding leadership abilities. She was inducted into the Sigma Theta Tau Mupi Chapter in December, completed the Ahex Scholars program, served on our executive board as secretary for GSWANS, that's our nursing student organization at GSW. Faculty shared the following about her. She is always prepared when coming to simulation. She really thinks her way through things and helps her classmates along the way. She's great with communication, always ready to learn, not afraid to ask questions, willing to try new skills and tasks. This year's recipient of the Mupi Award for Outstanding Leadership is Erin Reagan. Erin, will you please join me on stage? Tonight, Erin is receiving a plaque and a $100 scholarship award from Mupi. Erin has accepted a position with Phoebe Main in the critical care unit. And one more thing, in the front lobby of Carter 1, which is home to our School of Nursing, Mupi has a plaque with all of the past award recipients. It has a single brass plaque with each of their names engraved on it. Erin's name will be added to this plaque. It's quite an honor. Help me congratulate Erin. If you'll notice in your program, there's two other groups that we're recognizing tonight. The next group I'd like to recognize is our Georgia Southwestern Association of Nursing Students, or we call them GSWANS. The purpose of the GSWANS organization is to aid in the preparation of nursing students for assumption of professional responsibilities. Pre-nursing and nursing students are eligible to join this student organization. Our GSWANS chapter is very active, mentoring pre-nursing and nursing students, and is involved in community service on the GSW campus as well as in Sumter and the surrounding counties. I'd like to recognize tonight the GSWANS Executive Board for their hard work and dedication to this organization. When I stand, please call your name and remain standing until all names have been called. Isabella Cushing, Meredith Elliott, Cameron Lynn, Erin Reagan, and Madison Scala. Please join me in giving this group a round of applause for their hard work and dedication. Thank you, guys. And the last group listed in, denoted in your program that I'd like to recognize is our Ahex Scholars. The Georgia Area Health Education Center, or Ahex Scholars program, is a multidisciplinary certificate program for certain health profession students that offers opportunities for hands-on training, experience in rural and underserved communities, and networking with other students and professionals. This program requires a 2-year commitment and consists of 80 hours of classroom or online instruction and 40 hours of hands-on clinical training in addition to the regular coursework required by the degree program. The Ahex Scholars program is a program of the National Ahex organization that is implemented by local, statewide, and regional Ahex. Core topic areas covered in their curriculum include interprofessional education, behavioral health integration, social determinants of health, cultural competency, practice transformation, and current and emerging health issues. To be eligible, students must be enrolled in selected health professions degree programs in Georgia with a duration of 2 years or longer. The program does require a 2-year commitment and an overall minimum GPA of a 2.5. Applicants also should have an interest in rural and underserved health care. I'd like to recognize our 5 Ahex Scholars who have completed the program and are graduating tomorrow. Students, please stand as I call your name and remain standing until I have called all of the names. Isabella Cushing, Olivia Payne, Erin Reagan, Sarah Schatz, and Madison Scala. Please join me in giving them a round of applause. This is great credentialing for their resumes as well, now that they have finished and are seeking their first job.
Good afternoon. I'm Michelle Ragsdale, and it's so good to see you guys. I feel like I hadn't seen you in a while. I teach the junior level, and so they're so busy this semester. I see I think today is probably, I said, gosh, this is the first time I've seen you, so I'm so glad I get to see y'all and get to welcome you into this wonderful profession. So I'm going to read about the nursing pin that you're about to receive. The nursing pin that GSW nursing graduates wear at the completion of their education carries its own history and distinction. The pin was designed by the first 6 graduates of the associate degree program in 1956. The design reflects the front profile of the administration building at that time. The graduates who designed the pin were Mert Knight Radney, Lorraine Stanford Jones, Peggy Kitchens Killinger, Catherine Pritchett Mims, and Joyce Slayton. In 1975, the program's first 6 graduates of the new RN to BSN designed an addition to the pin, a wreath, which could be added to the original pin, until the associate degree program was closed. Graduates from this program would be pinned with one pin, and graduates of the RN BSN would wear the pin with the wreath. Since the program had its first graduates from the generic bachelorette program in 2002, one pin that combines the original pin and wreath that was later added is worn by our program graduates. So, nursing graduates, would you please stand so we can begin to receive your pins?
Ashley Ansley. Ashley will be going to work at Northeast Georgia Medical Center in Winder, Georgia, and she will be working in the emergency room. Tamisha Blue. Tamisha will be going to work at Southern Regional Hospital in Riverdale, and she will be working in NICU, neonatal ICU. Abigail Boysette. Abigail will be moving to the Miami area, so she will accept a position when she relocates. Isabella Cushing. Isabella will be going to work at Phoebe Putney Memorial Hospital. She will be working in the medical ICU. Taisha Davis. Taisha Davis is one of our, what we call AECP students, Army Enlisted Corps person. She is active duty military, and she will be going wherever the United States Army sends her. Colton Edmonds. Colton will be going to work for Phoebe Putney Memorial Hospital in the cardiovascular unit. Meredith Elliott. Meredith is going to work at Emory St. Joseph on the orthopedic neuroscience floor. Logan Felker. Logan has many offers. He hasn't decided yet which one he'll accept. Catherine Griffith. Catherine will be going to work at Phoebe Putney Memorial Hospital in the surgical intensive care unit. Our next student couldn't be with us tonight. She has a sister graduating from high school, but it's Hannah Gunter. So please, let's give her a round of applause. Brandy Carson Hooper. And Brandy is undecided at this time. She's still interviewing, so she can make the best decision for her as well. Madeline Joyner. Madeline's going to work for Phoebe Putney Memorial Hospital in the neonatal intensive care unit. Cameron Lynn. Cameron will be going to work with Phoebe Putney Memorial Hospital as an OR circulator with the ortho-neuro team. Brooksy Manning. Brooksy has accepted a position on Mother Baby at Atrium Navicent in Macon. Jessica Martin. Jessica has accepted a position with Phoebe Putney Memorial Hospital in the emergency room. Juliana Montgomery. Juliana is undetermined at this time. Olivia Payne. Olivia will be going to work at Phoebe Sumter Medical Center, working in the critical care unit. Aaron Reagan. Aaron is going to work at Phoebe Putney Memorial Hospital in the cardiac care unit. Shabrika Reddick. Shabrika will be going to work for Phoebe Putney Memorial Hospital in the OR. Sarah Schatz. Sarah's going to work with Phoebe Putney Memorial Hospital in the neonatal ICU. Emily Shaughnessy. Emily's going to work at the Atlanta Medical Center in NICU, neonatal ICU. Kaylee Short could not be with us tonight, but please help me recognize her. Amber Sims. Amber will be going to work at Phoebe Sumter in the emergency room. Madison Scala. Madison will be going to work at Phoebe Sumter Medical Center in the medical surgical unit. Ronnie Todd. Ronnie's still undecided. He's weighing his choices as well. Stephen Vakulowicz. Stephen will be going to work at Phoebe Putney Memorial Hospital. Megan Van Horn. Megan will be going to work at Crisp Regional in the intensive care unit. Bailey Wall. Bailey's going to work at Mercy Hospital in Oklahoma City, Oklahoma, in the emergency room. Tatiana Wellens. Tatiana's going to work at Navicent in Macon in the cardiac unit. Destiny West. Destiny will be going to work at Navicent in the NICU. Caitlin Williams, who's not with us tonight, but please help me recognize her. Susanna Wise. Susanna's going to work at Navicent on the mother-baby unit. And last but not least, Chloe Zoller. Chloe will be going to work at Northeast Georgia. Let's give them all a great big round of applause.
Good evening. I'd like the class of 2021 to please recite the Nightingale Pledge with me. I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I'll abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Congratulations.
Y'all may be seated. I didn't realize how many memories we're gonna come across in seeing all of y'all again. I know I had a small group with practicum this semester, and I had y'all fall semester, but anyway, it's been a lot of good memories for me, hopefully for y'all too. I am delivering the closing remarks for the penning program, but I really think it's safe to say that I'm speaking on behalf of all the faculty. Through your studies in the program, we've tried to equip you with those technical, communication, and professional skills. However, and I know that you've heard this before from multiple faculty, we cannot prepare you for every scenario that you're going to face. We do hope we've given you solid ground to stand on. I found a letter written by another nurse, and I would like to share that with you. Dear future nurse, you have 30 seconds and a hallway to pass through. They won't tell you that in nursing school. Yesterday, I walked into a room and told a wife that her husband didn't have a heartbeat, while she cried over the top of me as I did my assessment. My hands trembled as I took the stethoscope to his chest. That part never gets easier. The lump in my throat grew bigger and bigger as I recalled all the moments I had with this patient over the past week, the good and the bad. I felt as if I was going to be sick when I remembered his smiling face waving at me through the window on the door just days before, the same window that I saw him taking his last breaths that morning. I walked out of the room and into the hallway. The hallway they don't tell you about in nursing school. I took the wife down in the car in a wheelchair as tears ran down her face, and I was helping her into the vehicle. She looked up at me and said, "What am I supposed to do now?" You won't have the answers to the questions you're asked. No lecture or test can prepare you for those moments. You have 30 seconds and a hallway to pass through. The hallway where you will have to compose yourself and move to the next patient. I then came back to the floor and went into another patient's room, as if I didn't just crumble between those doors. I had to pack her up because she graduated from my unit, and she was being moved to another floor. That is a good moment, a happy moment. Take this one in. She told me that I was beautiful. Now, you might do a quick vision or neuro assessment after that. It's okay, you were taught how to do this in school. And she made me laugh with her witty jokes about a cute boyfriend. You won't know how much I needed that laugh. She is going to be all right after a long struggle with her illness. Pushing the same wheelchair, I transport her to her new room as we laugh and joke even more. Once we are there, and as I'm helping her up into her bed, she looks at me and says, "What am I supposed to do now?" You might have an answer to this one, but no lecture or test can prepare you for those moments either. Back to your floor, back through the hallway, you have other patients to take care of now. You might have the book smart, you might have some critical thinking skills. However, if you don't have the heart, the compassion, the will to fight each and every one of your patients' battles as your own, please choose something else. If you think nursing school is hard, I promise you, to be a nurse is so much harder. Nothing, no one prepared me for the 30 seconds I would have to compose myself from room to room. 30 seconds to go from death to a celebration. 30 seconds to go from bad news to great news. 30 seconds to go from being yelled at and hit to being the best thing that could ever happen. 30 seconds and a hallway to pass through. They won't tell you about that in nursing school. And it was written by Tanya Jarvis. That's who wrote the letter. As you embark on your nursing career and venture away from these nursing school and university walls, each of you will provide care in a multitude of settings. Use the skills and knowledge you have gained through this nursing program, but also don't forget to put heart and caring into your work. It's okay to cry, to get attached, to feel. The world is wide open to you. Go be the best nurse you can be. Again, congratulations to our May 2021 nursing graduates. We look forward to seeing you at graduation tomorrow morning. Let's give them a round of applause. Families and guests, if you'll please remain seated until our graduates have exited. You all are invited to fellowship outside the Storm Dome so it can be cleaned and prepared for graduation tomorrow. Thank you.